Should be coming up here. All right. All right, Melissa. Well, thank you so much for being on the show.
You're so welcome, Kirk. Thank you for the invite.
Yeah, no, obviously it's a really important time for Medicare with the open enrollment. So I definitely wanted to get clients and folks who come to the podcast and the blog, all kinds of information, just so they can kind of understand a little bit about Medicare in general. I just still find there's so much misunderstanding amongst people as far as what Medicare does and what they need and how to do it. But then also to kind of look at some of the mistakes people make when they're doing it, as well as what should they be thinking about during this open enrollment period. So figured bring in your expertise to kind of give us, I guess maybe just start with the general overview of Medicare, if you could.
Okay, let's move along then. Let's look at the first present slide of being the overview on Medicare.
Okay.
It's important when you are first eligible for Medicare that you have a good foundation and education.
Okay. And let me get this working here.
Okay, while you're doing that, I'm going to get a hard copy in front of me. So when you typically people will have Medicare A as an apple, that is your hospitalization. If you work at least 10 years or your spouse has worked 10 years, there's a zero premium for Medicare A. And that is your hospitalization. It's nice that there's no premium. If you did not meet those guidelines, then there are premiums associated with it. There are some deductibles and there's some copays that are related. A Medicare supplement or a Medicare Advantage plan will help mitigate some of those deductions and copays.
Okay.
And then Medicare Part B is your medical insurance. This will be your doctors and nurses and diagnostic services, whether you're in the hospital or out of the hospital. So when I mentioned Medicare Part A is hospitalization, that is for the facility and the general expenses of general nursing and things that they can't specifically itemize. And it'll be your short-term skilled care, rehabilitation, let's say. You have a hip replacement or knee replacement, you go to the hospital, you stay 3 days, and then you go to a Medicare approved rehabilitation center, and within 30 days of being in the hospital, and you stay there getting skilled care, not custodial care. So skilled care is going to be physical therapy, occupational therapy, those kinds of things. You're not going to want that one.
Okay, hang on. I love these technical difficulties.
So those kinds of things are the skilled care. Custodial care would be long-term care insurance, and that would be with helping with bathing and dressing and eating and transferring bed to chair, something like that, toileting, utilizing commode and personal hygiene, and also continence would be the diapers. So those things are not what Medicare will cover, or cognitive impairment. That's what long-term care will cover. So if we can scroll down a little further, that would be helpful. Okay. So within Medicare Part A, you will also have, during that skilled care, provided you met those thresholds that I told you, needing help with at least needing skilled care, and the services you receive are going to keep you at the same level or improve you, then Medicare will pay in full for 20 days. Then the 21st through the 100th day, if you're still meeting that threshold, then they will pay everything except a copay. In the current year, it's $176 a day. Some Medicare supplement plans will pay that, and most of my clients do select a plan that will cover that, but not all do.
Okay.
And then hospice, if you qualify for hospice by Medicare for inpatient care, then a Medicare supplement could take care of the difference, and many of those plans do. There are some variances. We're going to show you those in a little bit. So moving forward with your Medicare Part B, as in boy, this is another part of Medicare. This is those doctors, nurses, diagnostic services. Now the premium here is listed at $144.60. This is for 2020, and it'll go up to $153.30 in 2021.
Okay.
Now you think that that's okay, that's manageable, that's less than I was paying when I was working, and this is true. However, if your income is higher, if you're filing jointly, if your income is higher than that $174,000 listed there, then you are going to pay a higher premium than the $144.60. It's called income related monthly adjustment amount. And after I go through this sheet, oh, here we go. Kirk pulled it up for us. Thank you.
Yeah, let's bring it up now if that's okay, I guess, since we're talking about it.
This is perfect. So you can see on this screen that if you make more money, then you're going to pay more for Medicare Part B. People that are making if we go down to the bottom, if you're making over $750,000, you're going to pay almost $500 for what people making less than $174,000 are paying $144.60 for the same benefits that we're just discussing.
Okay.
In addition, Part D, which is your drug plan, Part D, you'll pay the premium that the insurance company is going to say, whether your premium is $15 a month or whatever, but you're also going to be assessed that additional fee of $12.20, $31.50, $70, whatever, based upon your income. They look back 2 years. And the reason they look back 2 years, think about it. January 1st of 2020, what tax returns did they have? They had 2018, right?
Mm-hmm.
So that's what they're using. They're using 2018. Now, if you've just retired or you have a change in income, a reasonable change in income, there are certain criteria when you can appeal that decision. And I do recommend you do that if you qualify. It's only a 2-page form. It's not hard to fill out. Might be 3, but it's not hard to fill out. It's a lot of words. Check off some boxes and put some figures in. So it's definitely worth doing, especially when you're just retiring or your spouse has just retired. Because these are very significant dollars. Let's go back to the other slide. These numbers are going to adjust with inflation.
Okay. And real quick, so if somebody has like a one-off financial event as well, like maybe a stock option exercise or, right, like before they leave work or something like that, can they also apply for a waiver? Or, I mean, have you seen that happen before? Like they have, either it's a big inheritance that was in an IRA or something like that. I mean, can that, if it's truly a one-time event, can they request a waiver for that as well?
No. Okay. So I just put up the form. It says it's 2 to 8 pages. The first one's only your Social Security and your name. So the reasons you can appeal are life-changing events. And here they are. You get married, you have a divorce or annulment, death of a spouse, work stoppage, work reduction, loss of income producing property, loss of pension income, or employer settlement payment. So when you settle, then I guess that would be it.
Okay.
But they are the reasons. So that would be the life-changing event. And then you indicate what your reduction of income is the year, your adjusted gross income, what your tax-exempt income is. You have to include that.
Okay.
And then you sign it.
Okay.
So it's those 3 pages. The rest of it's Privacy Act and all that instructions.
Okay.
But it's definitely worth doing. Many people are successful. And just when you get the answer and you don't think it's right, you appeal again.
Okay.
And it works.
Okay.
Sometimes it works if it's legitimate.
Okay.
Because that's a big number. But keep in mind, they'll redo it every year. So you're only looking at 12 months. So keep your stress down.
Yeah. Yeah.
Okay. Medicare. Simplistically, Part B, Medicare is going to pay. You're going to have some copays, and you're going to have. Then Medicare is going to pay 80%, and you'll pay 20%, or you'll get a Medicare supplement or Medicare Advantage to take care of it. And then the final item is Medicare on Part B. Medicare doctors who are accepting Medicare are permitted to charge 15% higher than Medicare approved amounts. Keep in mind, do you want to be paying these extra 15%? There are a couple of Medicare supplements that will take care of that 15%. You could check if you say, well, I'm okay with that. But then when you work with a doctor, you're going to say, are you accepting Medicare? Oh, and are you a participating provider? When you're in your late 80s or when you're frail, do you think you're going to remember to ask all that?
Yeah, no.
I don't think so.
Yeah.
So I think it's really important that you pay attention. So that I strongly recommend having it be covered.
Okay.
Okay. So the next thing is a Medicare Advantage plan, Part C, or a Medicare supplement. A Medicare Advantage is going to incorporate, you still need to have Medicare Part B and Part A. And then you're within a network. So your doctors are in network. If you travel a lot, that will not be a good thing. And you have to decide that, yes, you're comfortable with that. There can be PPOs and there can be HMOs, but some of them will have additional services. Some of them will have vision or dental discounts kind of thing. So there are some additional benefits within them, but the key thing is it's a network. My clients go with a Medicare supplement, and I do not take care of Medicare Advantage. They're restrictive, and you really need to make sure that you're checking hospitals. Are the hospitals you want to go to if you get sick, are they in the right zip, in the zip code that if an ambulance comes to pick you up, they're going to the closest hospital? Is that hospital within your plan?
Okay.
And are all your doctors? And what if you get a disease later on and that the best doctors in a different plan or in a different state, where do you want to have care? Important things to do. You can't just change plans. You can change Medicare Advantage plans each year at open enrollment, but you can change from a Medicare Advantage plan to a Medicare supplement without underwriting, except during the first 12 months when you say, oops, I really didn't like that Medicare Advantage.
Okay.
It's only a one-time opportunity.
So even if somebody's pretty healthy when they first go on Medicare, I've seen where people go to Medicare Advantage plans because they're typically less expensive, or, they throw in gym memberships and, all these great little bonuses. But then if you get something that all of a sudden now you're not going to be able to go back to the traditional Medicare because you have to be underwritten. You're kind of stuck at that point, right?
Well, you are. There's one carrier that has less medical questions, and you can get it. If you're within 10 years of being on Medicare Part B, then you're in the first grouping of pricing, so a little better pricing. But then because you're a sickly soul, you're not going to get the level 1 rates, you're going to get the level 2 rates.
Okay.
But if you're 10 years out, then you've got group 2 pricing, which is much more expensive. And then you've got and you're not going to get level 1 rates because you're sickly, you're going to be on level 2 rates. And there can be a $300 difference a month premium for some older clients.
Wow.
Very important to pick the right plan when you start. If you stay healthy, then yes, you can switch. I don't have people switching that often, but I'm willing to do it with my clients if they're healthy. But we do not cancel the plan that they currently have until we not only know that they're approved, but we know what premium it is.
Okay.
So I make sure that there's almost a month at least to go through medical underwriting. So there's not surprises. I like to sleep at night.
Yeah. Yeah.
Is that good?
Yeah, no, yep,
Okay.
yeah.
All right. So then the next thing is a Medicare. What does and this, we're still in the big picture here. Medicare supplement is going to take care of deductibles and copays that Medicare A and B do not cover.
Okay.
If you were 65 Medicare eligible prior to January 1st of 2020, you are eligible to purchase Medicare Plan F as in Frank. But if you were just turning 65 January 1st, 2020, or Medicare eligible because of disability, you cannot buy Plan F. You have to, the most comprehensive plan is Plan G as in goat. Even when Plan F was available, most of my clients buy G. And that is going to take, and simplistically, what that's going to do is Medicare A, deductibles and copays will be exactly the same as Plan F. So you're not going to pay any cost for hospital until you've been in the hospital for 515 days for one benefit period. So that's pretty comprehensive.
Yeah.
And it'll take care of that $176 deductible for rehabilitation, for rehab centers, and you won't pay anything for hospice. So exactly the same. But on the Part B, you have a deductible each year. It's $198 in 2020.
Okay.
So that's insignificant. Everybody who's under 65 is thinking, $3,000, $6,000. So $198 is like chump change there. Very good. But everything else is exactly the same as F. This plan, both Plan G and Plan F, will take care of that 15% of those excess charges I spoke of before.
Okay.
So that's big picture there. Now let's go to Part D. Right now we have open enrollment for Part D from October 15th to December 7th. Happens every single year. Every year you should look at your Part D coverage.
Okay.
Formularies change, carriers introduce new products, their premiums change, their copays change, their pharmacies that are preferred change. So lots of changes. So we have 4 stages. The first dollar when you get a prescription, according to your plan, you may be subject to a deductible. Some plans will, they're tiers for drugs, tier 1 through 6. Preferred generics are tier 1, generics are tier 2, and going down the line. So some plans, tier 1 drugs, you don't have a deductible, but tiers 2 through 6 you will. So those you might get for, generally preferred generics you get for free. Most plans, tiers 3 to 6, are subject to the deductible. So that means the deductible means you pay that, and then you pay copays. Then you get into initial coverage period, and these figures are changing each year. So I'm looking at 2020 figures. I believe it's, let's see, yes, it's still 2020. So for the cost that you pay and what the insurance company pays, when it gets to be $4,020, then that's when you're still in the copay. Until you reach that, you're just paying copays, whether it be $20 or a percentage. Once you get to that higher figure, then you get into the donut hole or coverage gap. During this time, you will pay a higher copay, and that'll be 25% of the cost. You'll stay there until what you've paid out is $6,350.
Okay.
When you've paid out that much, you're going to move into catastrophic, and then you're just paying 5% of your drugs. Keep in mind, when people are getting into that area, they're taking very expensive drugs. So it can still be very significant. So thank you for having that up.
Okay.
We are going, I have since buried my list. Okay, the next thing we're going to review are Medicare supplement plans. And they're designated by letters. And they're exactly the same coverage, whether you are using, getting one carrier or another carrier.
Okay.
So this says Thrivent. So that's just one of the insurance companies that's out there. This will be exactly the same regardless of carrier.
Okay.
If you are disabled prior to age 65, been on SSDI for Social Security disability for 24 months, you are then eligible for Medicare. Currently, the plans you're able to get are either Plan A as an apple, and these are not parts, these are plans. The previous page we looked at, it was Part A and Part B and then Part C being supplement or advantage. These are plans.
Okay.
So Plan A and Plan D are the two that are available for disabled people. If you're not disabled, then you can get any of these plans, provided you health qualify or you have a special enrollment period. And that's a new word, a group of words phrase that I'll go over in a couple minutes. So you can see as you go across from the left to the right, they're starting to get more enhanced benefits. If you go down the column with F as in Frank, you see all the buckets are filled. If you pay that premium, you will have no copays, except when you go out of the country. And G, you see they're all filled in except for that deductible, which was $198.
Okay.
Plan G has a high deductible plan now in 2020, and you are responsible for a certain amount of around $2,400 that you pay all that in, and then you get into the copay like the rest of the G. I don't have people doing that because the premiums for a married female at age 65 is around $120 a month. So if you're only paying $120 a month, why do you want to pay first dollar coverage of $2,300? So I find, and you need to get into a plan that you're going to stay with. So that's one of the reasons they don't go there. So let's go to the page 2 of the same document, Kirk. Now, when you look at these other plans, you can see Part A deductible, that's hospitalization, 50% or 75% or 50%. That's pretty big exposure if you're going to pay that for hospitalization. I do not have people going with that at all.
Okay.
N as in Nancy. I sort of compare this to group health insurance. You're used to, when you're before 65 or individual health, you're used to paying copays to doctors. You know, you go to a doctor and you pay $20. If you go to an ER, before 65, you're paying $250. But with this, you're paying $50. So if you want to continue to pay those copays, then Plan N is a little less expensive than Plan G, but you're going to have all those costs. And as we get older, we have more health issues, and we probably will be collecting more doctors and attending more doctors. So I think those costs will be escalating. But it doesn't take Part B deductible, which I'm fine with paying the $198 in today's dollars. It does not cover those excess charges when doctors want to charge you more. So that's one where as you get older, and even now, you're going to have to make sure, are you a Medicare approved doctor, and are you a participating doctor? And if you're in the hospital, you don't know who all those doctors are that are giving you bills.
Sure.
So,
Sure.
Caution you, if you select N, you just need to be very astute.
Okay.
So they're the plans for Medicare supplements. So how do you?
So I mean, do you see most of your clients going to the F and G for the most part, or are they all over the map, all the way from A to N?
My disabled people are going with A as an apple.
Okay.
Because D, that premium, it might be a $400 difference per month.
Okay. Okay. Wow.
It's just it's just so much difference in premium.
Okay.
That they decide that they're going to chance it. The younger disabled people, sometimes they go with a more expensive one. But people that are within 5 or 6 years that are going to be 65, that's another important thing. If you're disabled and you have a plan like A or D, and previously that was C, that was available. When you turn 65, you can pick another plan. So it's very important, because you're not going to be able to switch plans. You know, if you're disabled at 30, you're going to stay in that plan until you're 65. Okay. But at 65, you've got that open enrollment with no questions asked. So, definitely look for a better plan, because you'll pay a lot less money and get more coverage. Okay. But most of my people will go with G as in goat.
Goat. Okay.
Yeah.
Okay.
Okay.
Which is, again, basically that's F except for the Part B deductible.
Right. And even when F was available, even prior to 2020, I had many people going with G. I've recently had a lot of people switching from one carrier, and they're older. They were used to Plan F, but now the premiums have just escalated so crazily. And if they're healthy enough, then I can switch them.
Okay.
And I'm independent, so I shop the marketplace.
Okay.
To look at them. They have to answer lots of questions for me, but because I don't like declines, but we'll still try to save them money.
Okay.
Okay. So what do you do when you're trying to figure out which Medicare supplement you want to have? After you select the plan, and let's just say you select a G or you select an N, I really don't see people looking at other ones if they're 65 or older. Pricing is going to be different. Some of them have household discounts. Some of them will have marital discounts. Some of them will say, is there just somebody living in your household? And sometimes it's somebody 60 years old or whatever. So you want to look at what's the cost going to be for you for these different plans. And then you want to eliminate ones. I personally eliminate those that are not A-rated or higher by AM Best. That is a rating system for insurance companies. We want to make sure that we want to be with a strong insurance company that's going to be around. Remember, we're going to stay with this carrier possibly forever.
Okay.
We don't have to stay forever if we're healthy, but we might be staying with them forever, so we want them to be around. We also want to look to see how many years have they been in the market. If they're just getting their toes in the Medicare world, we might not want to be there because they might not stay. So that would be important. The next thing is recent rate increases. I haven't been able to get a whole listing. Some like long-term care, I can Google it and I can find long-term care rate increase histories. So I can't find that on Medicare supplements, but I've started collecting it on my hard drive. So I look at to see what kind of rate increases in the last few years have we seen, to be able to give the clients an idea that this carrier, we're looking at an 8% in recent rate increases, and this carrier was 15 or 12 or 14. So put that in the mix. Doesn't have to be a deciding factor, but information is, you need to have data to be able to evaluate things.
Okay.
And then you also have to say, are there, do you have a preference about carriers? Some carriers might be politically motivated, or you might have read something online or whatever, and you don't like their philosophy. So those kinds of things. You also want to consider, do you want to have a gym membership? Kirk mentioned that. Now in Maryland, some states you can ask, I know we're not just talking to Maryland residents here, but in Maryland, you would have to ask me if there are additional discounts with a plan.
Okay.
But in some states, I could say, oh, with this carrier, you could have, if you pay 25% more, $25 a month more, you could have a gym membership. Or with this carrier, yes, the premium's higher, but you could have silver sneakers, which is a gym membership kind of thing. Or this one has iMed. Many of them have iMed, which is a discount for vision. But I couldn't share that with you unless you asked me in Maryland.
Really?
Yeah, there are certain states.
Oh, just curious, like what would be the reasoning behind that? Like, why do they? I can't quite understand. Is it mandated by the states, you think, or the insurance companies?
I think it's no, it's not. It's across the board for all insurance companies. I think it's because Medicare supplement plans A through N are exactly the same benefits regardless of carrier.
Okay.
So then some of these carriers are adding these extra little features, whether it be hearing aid discounts.
Okay.
Or $100, only $100 for a hearing aid exam, and then $250 discount on a hearing aid.
Okay.
So therefore, we're getting to the point that all plans are not exactly the same.
Okay.
So I can see why.
Okay.
but I like to be well informed.
Yeah.
I like people to ask me.
Okay.
Sometimes they ask me anyway because they hear advertisements for Medicare Advantage.
Okay.
Well, that one has vision and dental, does this. And then I can say it.
Okay. So the bottom line for anybody watching this or listening to this is ask questions.
Yes.
Ask what additional benefits they can get from their plan.
Yep.
Okay.
Okay. I think you learned something.
Yeah, I did. I didn't know that.
Okay. Now let's talk about how do you look at Part D for drugs? That's something that, remember, you should be looking at if you're already on Part D. Oh, you know what? Before we go there, I got to talk about special enrollment periods.
Okay.
Because if you have, we're not doing the enrollment, so hold that first. But you've got special enrollment. Let's say you're working. You or your spouse is still working, and you have group health insurance. You are going to have a period of time that you can then get a Medicare supplement. So it's not necessarily we're going to get into enrollment periods at the end, but I just want to make sure that you realize that you could have Medicare A while you're still working, or you could have and have group health insurance.
Okay.
There are special enrollment periods that it might not just be at 65 that you're looking at these Medicare supplements. It's when you get within Medicare Part B.
Okay.
Okay, so I just want to make sure that that's clear. Now let's go to Part D for drugs. And there was did I send you a Part D one?
Let's see.
Okay, so while you're getting that, Part D, I recommend that you do create an account on Medicare.gov. That way, when you enter in, you have a username and a password, and when you enter your drugs in, it will retain that. So every time you're saying, oh, I want to look at that again, it'll still be there, and you can look at it. So you're going to enter your drugs, watch your dosage and your frequency. If you only get a drug once a year, put it down just in once every 12 months. It's only for shopping. You're not agreeing to buy it. You're only shopping. And then after you enter all your drugs, you've got name of the drug. Do you want generic or brand? If you put in the brand, it'll say, do you want generic? And you click that button. And then dosage and frequency. Then the next screen will be pharmacies. You're going to find least expensive pharmacies are going to be mail order or preferred pharmacies. They vary by insurance company, and they vary from year to year. So that's where do you want to get your prescriptions? Some of them like grocery stores. So I tend to like people to try mail order, and then I ask them what grocery store they like to go to that has a pharmacy. I try to include that. Thank you. And then I also like to go in with some CVS's, a Walgreens, whatever, some of the major chains. If they like a special little pharmacy around the corner, we can put that in. Generally, they're going to be standard pharmacies, or they're going to be not even in the network, and these are crazy prices. So you want to be able to select your pharmacy, and then you sort your plans. Typically, it says review plans. So then we're reviewing the plans, and I typically will look at 3 stars. One of the major insurance companies only started with Medicare Part D, I don't know, maybe 3 years ago. Yeah, that's giving you the same information we talked. I did update this slide that you're looking at for 2021 figures.
Okay.
Whereas the first one we looked at was 2020. So when we're sorting it, I usually do 3 stars, but for one carrier, I'll sometimes change it down to 2 so that I can see whether that other carrier is in the running, because it's got 5 stars for some of the captions. And the reason it's lower is because it hasn't been around long enough. And then you select a plan. So if I work for the clients that I work with for Medicare supplements, and I do help them with their Part D, we use Medicare.gov to shop. And then we go into the respective carrier to apply. So now we're going to talk about what kind of mistakes can happen.
Okay.
if you are on Medicare A, or generally it'd only be the A, don't continue to contribute to a health savings account. If you've been working and then you're retiring down the road and you didn't have Medicare A, and then you sign up for Medicare A, they go back 6 months. So you think you're good because I'm just planning on retiring and I'm going to sign up for Medicare A and B, but they don't realize that A is going back that 6 months, and oops, I contributed to an HSA. So you're going to have to get a refund for those amounts, because otherwise you'll get penalized. And penalties are not good.
So if somebody's working, they're 65, and a lot of the advice is to go get on Part A because you're not paying for it, even though you have private health insurance. Are you saying don't go on to A, or if you do go on to A, make sure you just stop the HSA contributions at that point?
Stop HSA. If you're contributing to HSA, stop Medicare A. Stop contributing.
Okay, but they go 6 months back. So let's say, so my birthday's in August. So if I'm going to go on at 65 in August, but I'm still working, I'll have a private plan. As long as I don't make a contribution past February into my HSA, I'm okay though. So I could do the full annual amount in February or earlier and still be okay?
Oh, you need to talk to a tax professional about that one. I don't know if I know one of those.
Okay.
I don't know how they do it with prorating. That'll be your area of expertise on that one.
Okay.
But I have had a number of people that have had to go, like they're retired at the end of the year and they've contributed. They've had to go back and get refunds for the period of time that they went back that 6 months.
Okay.
So that's important. If you work for an employer that has 20 employees or more, your group health insurance is primary.
Okay.
So therefore, if you had that $4,000 deductible and you were in the hospital, then your group health insurance goes first, and then Medicare, if you had Medicare A, that would pay some of the difference.
Okay.
But if you're if you are with a small company of less than 20 employees, Medicare is primary. So when you turn 65 and you don't have group health insurance from a partner or a spouse, then you're going to go on Medicare A and B when you turn 65 because of that. Because it's, your Medicare is primary, and if you don't have it, even if you had group health insurance, that's only taking care of that 20% that Medicare doesn't pay.
Okay,
so that's important. If you ever consider dropping a Medicare supplement plan, please do not cancel it before you get another plan. Because what if you're not healthy enough to get the other plan, or you've got a $300 higher premium?
Okay. So
it's very, very important. Then I already told you about that. Dropping a drug plan mid-year. You don't want to do that. You can't get back into another one. We've had clients that have forgotten to make a payment. So I do recommend you, if you are collecting Social Security, have them deduct the Part D premium out of your Social Security.
Okay,
because that's going to be happening. If you don't make a payment, you can't get back on. You're going to get a penalty of 1% for every month you don't have it, not on your premium, but on the national average. So it is higher for the rest of your life.
Okay.
So that's very important. If you're in a Medicare Advantage plan that includes drugs, and you're just fed up with it, which people do, and they get fed up with it and they just drop it, and then they call me, and this just happened this week, and said they want a Medicare supplement and they want a Part D plan. Well, it's open enrollment for January 1st, but I cannot get them coverage for November and December.
Okay.
They canceled their plan October 31st, and we're applying for a Medicare supplement for December 1st. But they're going to be without coverage for Part D for 2 months.
Okay.
At the end of the year, or probably in October, when your Part D carriers are going to send you letters. And in many states, this year, one carrier rebranded, and they're mapping. They're saying that if you have Plan A, Plan 2, you have Plan 2, we're going to map you to this new Plan 5. Plan 5 is more expensive. But if you fill out this, if you want to keep your Plan 2, you can fill out this 2-page re-enrollment form, and you can keep this less expensive plan. But it takes action by you to make it happen. In Maryland, is not requiring you to do that. There are like 5 states that you don't have to do it. But the rest of the country, that particular carrier, the clients are going to have to actually re-enroll in order to keep that less expensive plan. So make sure you read all your correspondence. That's really important. And now you want to go to enrollment, Kirk, or do you have any questions?
No, that's great. No,
okay.
Sir. Okay.
So the time that you're going to enroll, typically Part A, you're going to be 7 months surrounding your 65th birthday. That'll be 3 months prior, the month of, and 3 months after. Now, if you apply after your birthday, the coverage isn't going to be effective right away. So, the start dates will be different. But there's no penalty if you enroll later. So when I was telling you, if you're working for a large employer and you have the HSA, don't worry about it. Part B, you could apply at the same time as you have Part A, if you like, the same thing. Or if you have group coverage from an employer for working coverage, not retiree coverage, and not COBRA, it has to be because you're working, then you've got 8 months in order to get special enrollment to purchase Part B. And if you've missed that, and I've had clients miss it, then you have an opportunity once a year between January and March 31st to apply, but it's not effective until July 1st.
Okay.
So, there's a penalty when you don't apply for Medicare Part B on time. Then the next choice you have is the Medicare Supplement or Medicare Advantage, and we've spoken about that. The important thing for Medicare Supplement, when you get onto B, most of my clients, when they go on B, that's when they're looking at getting a Medicare Supplement. But you could also do it within 2 months of losing your credible coverage.
Okay.
Drug coverage. If you've dropped your group coverage, your group drug coverage, you do have within 2 months able to change to a Part D plan. And other than that, it's an annual enrollment period.
Okay.
So this is very, very important. They don't bend rules. The rules are the rules. And this is a very simplistic version of presentation of what the enrollments are. If you move to another location, it's when did you tell Social Security that you were moving? And then the month of your move and 2 months after, you get to make a change. Okay. Or if you do it after you move, then it's that month. It gets into a little more complicated. Okay. Medicare.gov is a good website. It has very good resources. You could also download an app. It has a big M in the App Store or the Google Play if you have an Android phone. And it's also on the Medicare.gov where you can say, is my test covered?
Okay.
Any questions?
No. I mean, this is great stuff. It's, but it kind of goes to show you why I want to go through this, because there's so many moving pieces. There's so many rules and regulations that you can see how so many retirees are just paralyzed when they go to make a decision. Or the other bad thing is once they're in, they might just stay there because it's such a pain to look at it. But like you said, during this period right now, you need to be looking at your Part D and do it every year just to make sure. So,
yep.
No, this is fantastic. And so if somebody wanted to kind of catch up with you, ask you questions, maybe see about having you help them figure out their plan, what's the best way to get a hold of you?
They can call my office at 410-557-7907 or email me at Melissa, Melissa, at Baygroup, and that's BAYGROUP, insurance, all spelled out, .com. And my website is baygroupinsurance.com.
Okay. Excellent. Well, Melissa, thanks so much for doing this. This is just the information that we needed to get out to folks because, yeah, again, it's just so convoluted. You know, A through N's on your supplements, and and then you throw in how many providers for each of those. It's a matrix to try to navigate this stuff. So, and I especially like how you're kind of tracking some information that they're not producing. As far as what are the rate increases year to year, and so there's a wealth of information there with you. So again, thanks so much. And if anybody has any questions, again, reach out to her at the phone number or go to baygroupinsurance.com and you'll be able to connect with Melissa.
Great. Thank you for having me, Kirk. Have
Absolutely.
a great day, everybody.